employer offers through ACWA JPIA. All members are covered dependents. All members and covered dependents in the Anthem Classic, Advantage, and CDHP are eligible for this great new benefit. So my name's Katie Wilcox. I'm an account manager from within Progyny. I'm very excited to be sharing and walking you guys through this new benefit today. Before we do get started, I just wanted to mention one housekeeping item. So at the end of this presentation, we're actually going to open it up to a Q&A session. If you have more of a confidential question, I suggest that you send that directly to Jackie through just a chat to Jackie. If it is a question that you are okay with everybody seeing, then you can send it to the chat with all participants. But just keep that in mind as you do ask questions at the end of this presentation. So let's go ahead and get started. So I always like to start it off with sharing the Progyny mission. So here at Progyny, our mission is pretty simple, but it's quite impactful. So at Progyny, we aim to make any member's dream of parenthood come true through a healthy, timely, and supported fertility journey. A few things to know about infertility and Progyny. So 1 in 8 couples actually struggle with infertility. Most people don't know this, but infertility is more prevalent than diabetes, asthma, as well as cancer, but it is definitely not talked about nearly as much. And just because people don't share their infertility story does not mean that it's rare. You are not alone, and Progyny is always here to support you through your journey. Progyny is set up and designed in a way to ensure that everyone can have a family. That's everybody from LGBTQ plus individuals, single parents by choice, and also individuals that or couples that may need donor tissue throughout their family building process. So Progyny is very unique in the way that it's set up in offering Progyny Smart Cycles. So Progyny Smart Cycles offer a comprehensive care without complexity and are designed to fit literally every path to parenthood. All individual services, so that's like the appointments, tests, diagnostic labs, anesthesia, that's all bundled into what we call our Progyny Smart Cycles. So you can see from the diagram here on the right side of the slide that there are different services quantify or take up a different amount of smart cycles. So as you can see in this example here, and we'll actually go into a few more examples throughout the presentation, but as you can see from this example, an IVF freeze-all will take up 3/4 of a smart cycle, and then what's included in that is everything below. So that's the office visit, the anesthesia, the assisted hatching, all of that is included within that 3/4 of a smart cycle. And then when the member goes to do the frozen embryo transfer, that will take up 1/4 of a smart cycle. So in this particular journey, 1 smart cycle has been utilized. Because smart cycles are bundled and included, everything needed for a treatment, you will, and it includes everything needed for a treatment, you will never run out of coverage in the middle of a treatment. We believe here at Progyny that choosing the best path to parenthood should be up to you and your doctor, not mandated by your insurance company. Unlike other fertility benefits, Progyny doesn't mandate certain treatments, and we don't require a diagnosis of infertility. So I did want to call out some of the most popular smart cycles to demonstrate the coverage offered. So as we look at some of these core treatments, you can see the IVF fresh cycle, which takes up 3/4 of a smart cycle, an IVF freeze-all cycle, which takes up 3/4, a frozen embryo transfer, which takes up 1/4, an IUI, which takes up 1/4. I won't read through them all, but this just gives you an idea of all the different ways that you can go ahead and use the smart cycles. This isn't something that you have to memorize or know. And a little later in today's presentation, I will be talking about the support we offer through a patient care advocate. And your patient care advocate will be there every step of the way to walk you through things like understanding how many smart cycles you have left, cost estimates, helping you book appointments. Again, we'll talk through that a little bit later, but I did just want to show here some of the ways that you can utilize the smart cycles and just show that there are many combinations and journeys that we cover through here at Progyny. So I'm going to walk you guys through just a few sample journeys. So the first one I wanted to call out, and I'll just speak to the top one, and then we're going to move slides because there's a couple others that I want to talk through. But the first one here is a couple, and Catherine and her husband at the top here, and they're having trouble conceiving. So Catherine chooses an in-network reproductive endocrinologist and does an initial consultation. Then what she does is she undergoes an IVF freeze-all cycle. So you'll see that's where that 3/4 of a smart cycle is taken or deducted. And then from there, she goes ahead and goes through with a frozen embryo transfer, which takes up 1/4 of a smart cycle. So you can see from that particular journey, this couple has utilized 1 smart cycle. I'm going to move along to another sample journey. So this is Nora. Nora wants to start a family, but she isn't quite ready yet. She elects to freeze her eggs so she doesn't have to worry and can start her family the best time for her. Nora's PCA, or patient care advocate, helps her book an initial consultation. This does not affect her smart cycle balance. And then Nora undergoes fertility preservation, where her ovaries are stimulated by medication and she undergoes an egg retrieval. Her eggs are cryopreserved until she is ready to use them. So this whole process here will take up half of a smart cycle. And I'll walk you through one more sample journey. So here we have a couple that's going through something called reciprocal IVF. So this is Jessica and Sarah, and they would like to expand their family. Both partners would like to be involved in the family building process. So they elect to pursue reciprocal IVF. So first, they speak with their patient care advocate, or PCA. Jessica and Sarah go through an initial consultation, which does not deduct again from that smart cycle. Jessica undergoes an IVF freeze-all cycle, so that takes up that 3/4. And then they move forward to or Sarah moves forward with the frozen embryo transfer, and that takes up 1/4 of a smart cycle. Now, I mentioned I was going to talk through the support that you receive from a patient care advocate here at Progyny. So the patient care advocate, also known as a PCA, is really there for you throughout the entire fertility journey. And they're there to provide unlimited support. So whether that support is emotional, whether it's helping you facilitate maybe an upcoming appointment or coordinating treatment, they are there for you throughout that entire journey from start to finish. Also, something to note, I'll be mentioning how many smart cycles are offered through this program, but even if you exhaust the smart cycles, your patient care advocate is there to support you, even if you exhaust those smart cycles. So that's something I definitely like to call out. We understand that family building can be an extremely stressful experience. And so that's really why we provide that support from a PCA throughout your entire journey. PCAs here at Progyny are led by an in-house clinical expert team of reproductive endocrinologists, fertility nurses, clinical psychologists. So we have PCAs that really come from a breadth of backgrounds, and they really can help you, as I mentioned, with everything from booking your appointments, educating you on the path that you think is right for you. Really anything you can think of, your PCA is that go-to person throughout this entire journey. The PCAs are available from 9 a.m. to 9 p.m. Eastern time. So we try to make it a little bit of outside of work windows, if that works better for you. And they also can be available through email, portal, phone. So we make them accessible through different channels based on what fits best for you. And then again, I just want to call out, even if you exhaust those smart cycles, it's important to know that your PCA support will never expire. So think of it as unlimited support. You can always contact your PCA and have that person in your back pocket as you go through this process. Fantastic. All right, so At the core of Progyny's benefit are our providers. We are an in-network support. When you work with Progyny, you do have to use an in-network provider of Progyny's, which we offer 900 plus, or we work with 900 plus fertility specialists across 650 locations. And we have, I know mainly the team on here is based in California, and we have many clinics and providers based in the California region as well. So Progyny has a large network featuring many of the country's top fertility specialists. And we also have strict quality standards when we work with these physicians. So we ensure they're performing to the utmost best. And we also are ensuring that our providers are board certified, reproductive endocrinologists, and they must be doing more than 100 assisted reproductive technology cycles annually. So those are all requirements in order for them to be in network with Progyny. So just a couple of things to call out. Again, I would suggest that if you are looking to get started, connect with the patient care advocate. I will have a phone number at the end of this to connect directly with the patient care advocate, but they can help you get started with the process in connecting with a fertility specialist. And then treatment and medication is also approved simultaneously to get your treatment as soon as possible and to prevent any delays in care. So coordination between the pharmacy and Progyny is totally seamless. You'll never have to be on the phone or tracking down your medications as you're going through treatment. Medications through the Progyny Rx arrive next day or same day. And in cases of emergencies, if something is needed that same day, I've heard of members receiving medication on that day if needed. So there's never any delayed or waiting for your medications. We do understand that administering, sometimes you'll have to administer shots depending on which treatment path you have to take. And we understand that that could be a really scary process, especially for the first few times. So we do offer something called a 7-day-a-week counseling, and included in that is an unpack it call. And an unpack it call is with a pharmacy clinician who will explain which medication is which and how to store it, how to administer it, and so forth. So that's all available if needed. And then I also put a link here, which is helpful, and it has some helpful instruction videos, which will also walk you through the medication piece as well. All right. So I mentioned how many smart cycles. I would talk about how many smart cycles are offered. So the group here, as long as you're eligible for the Progyny benefit, and you're eligible for 2 smart cycles per lifetime, as long as you are enrolled in one of these 3 medical plans. So you have to be enrolled in one of the Anthem Classic PPO, the Anthem Advantage PPO, or the Anthem CDHP PPO plans to be eligible for the Progyny benefit. And what you're eligible to is 2 smart cycles per lifetime. Again, not stuff you have to remember. You can always connect with the patient care advocate and talk through this. And also as you start undergoing treatment or utilizing the Progyny benefit, we will be updating you with how many smart cycles you have remaining. It is important to understand though, and I like to call this out, that there is a financial responsibility. So the way it works is Progyny works hand in hand with your medical plan. So depending on which 3 of these medical plans you're enrolled in, it cross accumulates. So if you've already, for example, if you've already met your out-of-pocket max for the year on the medical plan, then that is the same for Progyny. So again, it cross accumulates with that medical plan. And again, there is potentially a financial responsibility. You can receive, based on which treatment path you're looking to pursue, you can receive cost estimates from the patient care advocates. So that's always a wonderful route to go if you want to just evaluate what costs would look like before you get started. And then something else I will call out. So this is eligible to the members as well as domestic partners and spouses. So as long as domestic partners and spouses are enrolled in the plan as well, they have access to the Progyny benefit additionally. And then what also is included is a reimbursement for adoption, surrogacy, as well as doula support, which is really fantastic. So ACWA JPIA offers a very generous $20,000 reimbursement for adoption per lifetime, as well as a $20,000 surrogacy per lifetime reimbursement, and then a $1,000 doula reimbursement per child. What's wonderful is our PCAs are trained on all of your options to parenthood. So if that is pursuing IVF or IUI, they can talk to you about that. But if that is to pursue your path to parenthood through adoption, surrogacy, or even get a support system through a doula, that is something a PCA has knowledge about and can speak to you about that process as well. They can give you average costs. They can walk you through what the process would look like. They can explain what common pathways look if you are to pursue adoption or surrogacy or doula services. And they can also connect you with resources as well. So if that's something, again, that you're interested in, where our PCA group is very knowledgeable and there to support you through whatever that family building journey looks like. So that is there, and that's honestly a wonderful resource that is available to your team. And then, as I mentioned earlier, I wanted to provide the patient care advocate a phone number directly to our patient care advocate line. So this is the number. I'll leave this page up, and I am going to open it up for Q&A at this point.
And we have no chatted in questions yet, Katie, so I'll let you know if we do. It looks like Carlene has a question. I think, Carlene, I think you can unmute yourself. If you can't, I will find you.
Hi.
There you go.
So I have a couple of questions. If an employee was already pregnant when this benefit began, this plan year, are they eligible for the doula reimbursement? And would they just call to ask about how to do that? Or are they not eligible because the pregnancy was already in progress?
That's a fantastic question. I might, from my understanding, I might turn that over to.
I can take that one.
Maybe Jack. Yeah.
The doula benefit is actually one of the benefits here that is for everyone. So anyone who is covered on any of the Anthem PPO plans is eligible for that doula benefit. So it doesn't matter if they're already pregnant, that benefit's available. And that one is a reimbursement. So you would pay out of pocket and then submit for reimbursement.
Okay.
And it does have to be a certified doula, by the way.
Okay. So they should, if they're interested in doing that, we should refer them to Progyny for instructions on.
Correct.
Okay. And then I have a second question. If someone was already in the progress of adoption or surrogacy or something like that when this benefit became available, would that employee be eligible for reimbursement or assistance if it was already in progress and they'd already had expenses that were incurred before the plan year?
And any expenses incurred before the benefit was in effect would not be retroactively eligible, but as far as the expenses incurred from this point forward, those should be eligible, but that's we'd really encourage that person to get in touch with a patient care advocate to discuss the specifics, unless you have more info to share on that, Katie.
Yeah, I would say the same thing. I would say for both of those, I definitely take down this number and have them connect with the patient care advocate, because they can help them with the one reimbursement for the doula services, and then talk through everything from January 1st, 2023 on, can help with the reimbursement for those around the adoption piece.
Okay, thank you.
Yeah, thank you for your questions.
I have a question that was direct message to me. The question is in regards to private adoptions. It's not something I can really answer, so I'm going to throw it out there to you, Katie. Does the adoption reimbursement apply only to private adoptions, or can it be applied to foster to adopt situations or adoptions? Do you know?
You know what, that would be a great question to chat with your patient care advocate about. There's a handful of different avenues that you can pursue when you're looking at adoption, and I would definitely encourage them to reach out to the patient care advocate and talk through that scenario with them. That's a great question, though.
Okay, thank you.
Yeah.
I see there's a question about if the slides will be available after the webinar. Katie, is it okay if we distribute those?
Absolutely, yeah.
Okay, great. And then there's another question about what information somebody needs to provide Progyny to show that they're covered. And Progyny has the eligibility information and knows who's covered on the plan, so they'll be able to look you up when you call.
Exactly.
I am putting answers in the chat, so hopefully, I think that the chat text stays with the recording. Sandra, do you know?
You know, I don't believe it does, so,
okay.
But I could be wrong. We'll cover it verbally just in case.
Okay, good. And I don't see any further questions in the chat, but maybe other folks have their hands raised. Let me see if I see anyone. I do not see any other hands raised right now.
A question did just pop up, Jackie.
Okay.
How do you find out if a doctor's in network? I have an employee that already started treatment but stopped due to cost. Can they go back to that doctor?
Yeah, so to find out if a physician's in network with Progyny, there's a couple ways. One, you can call a patient, this number here, connect with the patient care advocate, and they can inform you if they are or not. You can also go to our website at progyny.com, and there's a search tool where you can plug in the physician's name or the name of the practice, and then learn if they're in network. So whatever is best for you, you can find that out. Now, if they are out of network, the PCA again will be your best resource, because you're going to want to connect with them, and then you will have to work with the PCA in transitioning care to come into an in-network clinic.
And I see Ernie has his hand raised. Go ahead.
Yeah, I just have a question, I guess, regarding for the donor egg. So say if me and my fiance, we go through, once we get married, we decide to go through Progyny, and I use my sperm, and we need a donor egg because of her age. What's the qualifications of the timeline for that, as far as what's covered?
So yeah, great question. So you're talking through your sperm, potentially looking at a donor egg, and then what is covered through the Progyny benefit. So what is covered through the Smart Cycle offering would be anything that would apply to the dependent on the Anthem plan. So if that would be like the collection of your sperm would be covered, any testing that would take place on your sperm. And when it comes to the donor, we wouldn't be covering, Progyny wouldn't be, it would just be covering the members that are covered on the Anthem plans. Does that help answer your question?
Yeah, just more for like donor eggs. So just trying to find out if that's part of the plan, or we'd have to actually go out and pay for donor eggs to fertilize the sperm.
Yep. So the donor tissue is covered part of the plan as well, the PCA can provide you with more information and talk through like what potential, what that process would look like, what the time frame would look like, even provide you with resources in choosing the best resource to provide the donor tissue as well.
Okay, thank you.
Yeah. Thank you for asking.
So Katie, I have another question in regard, and I think I have asked you or one of the other folks at Progyny this exact same question. And I think I know the answer, but I'm going to let you say what the answer is. The question is, do certified doulas have to be part of a specific in-network company? My understanding is they need to be certified and that you guys will provide resources in finding a certified doula, but there really isn't a network. Am I right about that? Or is there more to that story?
You're absolutely correct. Fast forward, we are in the process of putting together a network, but that is down the road, but you're absolutely correct. So there is not currently a network, but they do have to be certified, and PCAs can connect you with a certified doula or provide resources to connect you with them.
Okay, thanks. So far we've gotten, I've had a lot of anecdotal evidence of people saying how excited they are about the doula benefit. The doula idea of a doula is really coming to into its own right now. So I think a lot of people are super excited about that. That
is awesome to hear. Yeah, I just recently we have a 9-month-old, and we did not go the doula route. And if we do it again, or when we do it again, I would definitely pursue that route. There are just so many benefits to it, and the level of support is quite amazing from what I've heard. So it's amazing that this is an offered piece of the benefit.
Very good. I don't see anything new. Sandra has posted on the meeting chat the Progyny website specific to ACWA JPIA in the link, awesome, as well as the link in regards to egg purchasing, which counts as 1 smart cycle. And just a reminder that our benefits include 2 smart cycles per lifetime.
And let me just call out one more time. I know I mentioned this earlier, but even if you exhaust those 2 smart cycles, you always have access to that patient care advocate. And I'll share this story really quick, but our patient care advocates are an amazing resource. We've had patient care advocates working with members so closely that we've had actually members name their babies after patient care advocates that they've worked with. And this is a true story. And so I urge you guys, if you're interested at all, call this number, connect with the patient care advocate. They're just an amazing resource. Again, they're there. They're available to you, even if you exhaust those 2 smart cycles. But I definitely like to give them the credit that they deserve, because they're just an amazing group of people.
And go ahead, Ernie.
Actually, I have one more question for the as far as the cycles, the smart cycles goes. Doing the egg, say we do the egg donor and use that 1 cycle to do the egg retrieval. Is that all included as far as 1 cycle for the egg retrieval, the fertilization of the egg to create the embryo and implant also, or is that going to be like a 2-step cycle?
So that would be, so the 1 smart cycle would take from the donor, the 1 smart cycle would be utilized for that donor tissue. And then the frozen embryo transfer again would be that 1/4, as well as if you were to do the freeze-all process. So that would be more than 1 smart cycle.
Yeah, so that would basically be the 2 cycles.
Correct.
Okay.
And I'll reiterate what Katie has been saying all along, especially if you folks on here are HR team members or people that handle benefits at your water agency, and you have employees that come up with questions to you and you maybe are struggling to answer them. The PCA, you can feel extremely confident in giving this phone number to your employees to get those questions answered. There's no there's no commitment required for them to call the number and just talk to a PCA and get those conversations started. So if you are getting lots of questions and you're not sure how to answer them, please feel free and don't hesitate to have the employee call Progyny directly, because they will get all the right information at one time.
And to your point, Jackie, there are so many different paths from beginning to end when it comes to utilizing this benefit, that there's not really a one size fits all answer for folks, because there are so many different ways that they could utilize this benefit. Another thing I wanted to share is that adoption and surrogacy, the $20,000 stipend or reimbursement for each one, do not count as a smart cycle. So those are separate benefits in addition to if you wanted to go both routes or ended up, maybe utilizing your 2 smart cycles and then deciding to go the adoption route.
Great point.
Yeah, thank you for calling that out.
Another question.
No problem.
I love it. Thank you.
So say if my work, we provide Progyny and I use my Progyny benefit, and my fiance, she also has hers. And so would we be able to combine or use both sides if needed?
Yes, as long as she's covered under one of those 3 plans, she has access to the 2 smart cycles.
I mean for hers, because her work also provides Progyny for her insurance.
Got it. Yeah, that's correct.
So we'd be able to use it the 2 times, for mine if I wanted to, and then hers separate for another.
Well, yes, so you would be able to access the benefit for treatments that would apply to you, and then she would be able to access the benefit through her work, through treatments that would apply to her.
Okay, perfect.
Yeah.
Thank you.
Oh, that's awesome. Any other questions?
I don't have anything else in the chat. So if we maybe just do a last call, anybody have any further questions, or just shout them out, or feel free to chat them in. Looks like everyone's gotten their questions answered so far, Katie.
Oh, good.
I guess we can go ahead and close this one out. Sandra, did you want to have anything further to add before we end the session?
I think we've covered it all. Thank you so much, Katie, for sharing this information with our folks. And thank you, everybody, for joining to learn more about it today.
Yeah, thank you, everybody.
Bye, everyone. And we will get this recording out and posted.
Thank you. Take care.
Right. Bye-bye.
Bye-bye.